Hi everyone. Today marks National Black HIV and AIDS Awareness Day. You may be thinking, why do we need this day? Which I intend to answer during this brief presentation. So let's look at the bigger picture. There are an estimated 325 million people living in the United States, with 42 million of them, or 13%, identifying as being African American, Black, or of African diaspora. Also, there are 1.2 million people living with HIV in the United States, and roughly 498,000 of those 1.2 million are Black. This equates to around a figure of 40% of those living with HIV in the United States are African American or Black. Additionally, Blacks account for 45% of new HIV diagnoses. That means for every 10 people diagnosed with HIV in the United States, almost half are Black. Here's some more context. When you look at the overall risk of being diagnosed with HIV during one's lifetime, that rate is 1 in 99 for the overall United States population, 1 in 68 for all men, and 1 in 253 for all women. When you look at race and gender combined, it is 1 in 140 for white men, 1 in 51 for Hispanic men, and 1 in 22 for Black men. And that last number has been disputed over the past few years, even is going as low as 1 in 16 for Black men. When we look at women, white women have a risk of 1 in 941, Hispanic women have a risk of 1 in 256, and Black women have a risk of 1 in 54. And lastly, moving to the group that's most burdened by HIV, which would be men that have sex with men, overall, the rate is 1 in 6 of being diagnosed with HIV during their lifetime. For white men, that number is 1 in 11, 1 in 4 for Hispanic men, and 1 in 2 for Black men. So you're probably asking what's going on, and you may be even speculating that maybe Blacks are using condoms less, maybe they have greater numbers of sexual partners, maybe among the IV drug users they're using non-sterile needles. Well, all of these factors do not hold water, and they do not explain the racial disparities in HIV. As various studies have documented that Blacks actually engage in all of these risk factors at the same rate or even less than our other racial counterparts. So what is going on? High rates of HIV combined with smaller sexual networks, meaning that Black people like to have sex with other Black people, higher rates of unknown HIV statuses, along with higher rates of sexually transmitted infections, which ease transmission and acquisition of HIV, stigma, including fear of disclosing risk behavior or sexual orientation, concern about disclosing HIV status, medical mistrust in healthcare providers, all may prevent Blacks from seeking testing, prevention, and treatment services, and also seeking support from other friends and family. And lastly, socioeconomic factors such as poverty, systematic racism, less access to healthcare, and higher rates of incarceration all contribute as well. Now, combined, all of these factors create conditions that allow for HIV to persist in our community. So what can we do? We can begin by educating ourselves about HIV. We can use Google and reputable sources to become more informed about this chronic illness. We can then use that information to dispel the falsehoods that perpetuate HIV stigma. We can get tested. Less than half of the US population has ever been tested for HIV, and 1 in 8 Blacks living with HIV in the US are unaware of their status. And getting tested is easier than ever. You can actually do it in the comforts of your own home. We can take charge of our sexual health. We can learn more about strategies like PrEP, which is a daily pill that reduces risk of HIV up to 90%. And we can also engage in other harm reduction strategies to reduce our risk. We should connect with medical providers. If you're HIV diagnosed, we should get connected and engaged with medical care to suppress the virus, as that is paramount. We should talk about this. We talk freely about other chronic illnesses that impact our community, like diabetes and hypertension, so why not talk about HIV? And lastly, regardless of our status, let's change the narrative about HIV in our community. Thank you for listening. I am Byron Brooks, a clinical psychology doctoral candidate at East Tennessee State University and a proud fellow of the Build a Brother Institute of the National AIDS Education and Services for Minorities.